It's tips time. Welcome to Training Intervention Program for Behavior Change. Tips for Behavior Change. I am your psychologist and behavior specialist, Geraldine Garwood. Please remember to like, subscribe, share, and click that notification bell. Today, I want to talk about major depressive disorders. During the pandemic, many persons have experienced major loss that has led them into depression. And it is important to assess your depressive symptoms to know if you are actually experiencing major depressive disorders. So, I want to take us through what is involved in major depressive disorders. Now, the DSM5, which is used to guide psychologists on different mental disorders, give a criteria for what would be considered a major depressive disorder. So the criteria is sad mood or loss of interest in pleasure. So if you are experiencing sad mood, you're really sad, and you have lost all interest in pleasurable activities or to engage in any form of pleasure, you need to begin to evaluate yourself. These symptoms, which is the sad mood and the loss of interest in pleasurable activities, may occur every day, most of the day, or for at least 2 weeks. Now, these symptoms are different or distinct and more severe than a normative response to significant loss. What exactly am I saying? If you have lost your job, you have lost your relationship, you have lost a family member during the pandemic, the symptoms that you experience are different from that sadness and loss of interest in pleasure. It is more severe. You have a more deeper yearning, and you can't find anything within you to make you feel happy, anything to smile about. You are extremely sad and you don't want to be around anyone. You don't want to be involved in anything that will allow you to feel any form of pleasure or happiness. So that is why it is different from if you have really experienced like a what I would call a normal loss, like a loss of a job, loss of a marriage, or loss of a relationship, loss of a cell phone, or loss of a family members. But the DSM-5 also state that with that criteria, and remember now the criteria is sad mood or loss of interest in pleasure. With that criteria, you should have four of the following symptoms. Four of the following symptoms. And these symptoms include sleeping too much or too little. So if you're sleeping too much, you're oversleeping, or you're sleeping too little, then you need to begin to evaluate yourself. If you have psychomotor retardation or agitation, meaning that your limbs, you can hardly move your limbs and you're agitated, then you need to evaluate yourself. If you have poor appetite and weight loss, or you have increased appetite and weight gain, then you need to evaluate yourself. Loss of energy, you don't have any energy to do anything. Feelings of worthlessness or excessive guilt, difficulty concentrating, thinking, or making decisions. You need to be checking off to see if you're actually experiencing any of those during this time. If you have recurrent thoughts of death or suicide, then you may be experiencing major depressive disorder. So the criteria again is sad, mood, loss of interest in pleasure, along with any four of these symptoms. Sleeping too much, oversleeping, sleeping too little, psychomotor, feeling like you can't move your limbs, you can't move, agitated, poor appetite or loss of appetite, weight loss, weight gain, loss of energy, you feel worthless, you feel guilty, you can't concentrate, you're not thinking, you're not making proper decisions, or you can't even make a decision, and you're having thoughts of suicide, death, then you need to seek some help. This may be saying to you that you are having major depressive disorder. So I'm going to provide you with some tips that you can use to help you as you deal with major depressive disorder. First, I would like to say develop coping skill to deal with your crisis. Now, easier said than done. So you may need to find a professional, sit with that person and go through what is happening to you, and then they will assist you in developing coping skills to deal with the crisis that you are facing. Identify negative beliefs and behaviors and replace them with healthy, positive ones. So, any negative thoughts that you may be entertaining, identify them, pinpoint them, and then you are going to replace those thoughts with healthy, positive ones. Develop positive relationships with others. So, I would encourage you to cut off all negative relationships and develop relationship with persons who have your best interest at heart, who will encourage you in a positive way, who will who will assist you with your challenges and will not criticize you or judge you. Also, pinpoint or identify the issues that contribute to your depression and change those behaviors that make it worse. So you can actually pinpoint the issues or the circumstances that may be contributing to your depression. And then what you can do is now change those behaviors that make your symptoms worse. Take control of your situation. And what do I mean by taking control of your situation? I go back to the point before that. Once you identify the issue that is contributing to your depression, taking control of the situation is exactly changing behaviors that make it worse. That's what you're actually doing. Learn to set realistic goals for your life. One of the main reasons why some persons may even experience major depressive disorders and other disorders too that are depressive, and we will get to bipolar 1 and bipolar 2 in my next video, is that they do not set realistic goals for their life. Set goals based on your resources or the resources available to you. Set goals based on your academic skills. Set goals based on your skill set that you possess as well. And it's important that you set goals and set objectives to meet those goals. Or you can set your goals, but once you have objectives are what lead you to accomplishing those goals. And lastly, develop the ability to tolerate and accept distress using healthier behaviors. What am I saying? You need to develop strength of character. Now, strength of character is difficult for most people to develop. And I always say that strength of character really comes about when you really have high self esteem. Once you're somebody with high self esteem, you will have strength of character. So nothing easily breaks you. But you can develop that ability. You begin to speak positive things into your life. You begin to put things in place to deal with any setbacks that you may encounter. What you're actually doing is that you begin to set proactive steps or entertain proactive thoughts rather than being reactive when you may experience a major challenge in your life. So I hope that these tips will help you and you will really sit and evaluate yourself to see if you may be experiencing major depressive disorder. Please remember to like, subscribe, share, and click that notification bell.